Good morning. My name is Will Young. I'm an orthopedics resident from UT Health San Antonio, and today I'll be presenting our research looking at the effects of postoperative intravenous acetaminophen in geriatric hip fracture patients. The purpose for our study was to look at the use of intravenous acetaminophen, or IVA, for postoperative pain control in geriatric hip fracture patients. Geriatric hip fractures are among the most commonly treated orthopedic injuries, and across the country, hospitals are implementing hip fracture protocols that take a multifaceted approach to optimizing the patient care for this vulnerable patient population. In particular, geriatric patients are susceptible to polypharmacy and the strong side effect profiles of opioid medications, which includes respiratory depression, constipation, and altered mental status. Potentially opiate-sparing medications such as intravenous acetaminophen are of particular interest. We wanted to look to see if using intravenous acetaminophen or IVA decreased total post-op opioid use, immediate post-op opioid use, had any effect on post-operative pain scores or hospital length of stay. We conducted a retrospective chart review where we identified 130 patients who were treated over a 2-year period by a single surgeon for hip fracture. Our patients were 65 years of age or older and received either intramedullary fixation, hip hemiarthroplasty, total hip arthroplasty, or closed reduction with percutaneous pinning. We found similar numbers of procedures in both the IVA and non-IVA receiving groups. Patients received between 1 and 8 grams of IVA in the postoperative period. Our data demonstrate that there were similar postoperative pain scores and similar opiate use in both groups. However, it was slightly higher in the IVA group. There was also a significantly decreased length of stay by about 1 day in the group that received IVA. Some limitations of our study include that it was conducted at multiple hospitals, was a retrospective analysis, and that intravenous acetaminophen was given at various dosage and frequency at the discretion of the primary treatment teams. In conclusion, our study demonstrated similar postoperative pain scores and similar opiate use in both the IVA and non-IVA receiving groups. However, there was a decreased hospital length of stay in the group that received IVA. This is consistent with other literature in this area, and the decreased length of stay may ultimately translate to decreased healthcare costs. Thank you for listening to our presentation this morning.